We're here at The Circle, a mental health crisis cafe and drop-in centre for young people in West London. Launched in December 2022 and open 365 days a year, it has quickly become a national example of a vital resource in the mental health landscape. If you would like to introduce yourself and your organisation and your role within it.
Yeah, absolutely, and thank you for having us. So my name is Anya Agwal, and I'm the Circle Service Manager at Hammersmith, Fulham, Ealing and Hounslow Mind, so HFEH Mind for short.
And can you tell us a little bit about what necessitated the development of the centre?
Yeah, absolutely. So there are kind of three main things here. So number one, there was an A&E audit, which basically found that a lot of young people were presenting to A&E kind of nearing distress or reaching a mental health crisis. And there wasn't any other options in terms of where they could go. So we kind of recognized a gap in the system and a gap where actually we wanted to make sure that young people were getting the right care with the right person. And it didn't seem that A&E was sort of the right place for that, especially around the kind of sensory aspects of it for young people who are kind of presenting with neurodiverse needs as well. So I guess on the other side of that as well, it's about alleviating the stress off A&E where it is really inundated at the moment. So that two-pronged approach of actually supporting young people to get the right support they need and also alleviating the stress off kind of A&E staff as well. I think the second aspect of it is around the NHS long-term plan and ensuring that a kind of key part of it is making sure that young people have drop-in centres when they're nearing crisis instead of going to A&E, where again we know that that's probably not the most suitable place for a young person to go when they're kind of nearing crisis. And I suppose that we think about that early prevention side of things as well, where it's not only intervening at the point where actually a young person is really distressed, but being a resource in the community where young people can access us, parents can drop in, get kind of psychoeducational resources for themselves. But we also do a lot of sort of social prescribing within our immediate community too. So it was kind of those key aspects which meant that actually we were in a really good landscape to do that. Mm-hmm. And that's in line with a lot of the other services we hold as well and how we work together with them to provide this.
And on an average day here, how many people would you see and what ages?
Good question. So in terms of an average day, every day looks different because we offer that drop-in component. We never know what's coming in. So some days we might get kind of 5-6 referrals. Some days we might have no one come in. But the key ages we're seeing at the moment is 14 to 16. Okay. And we'll think about kind of iaptus and how they've helped us to spot key trends. But definitely in terms of one of the key trends at the moment, it's around emotion-based school avoidance and what that looks like in young people, especially where they're going into their GCSEs, they're going into their A-levels.
And you mentioned that iaptus has helped in spotting data trends. Has it helped at all in any other ways with this service?
Definitely. I think in terms of the referral pathway we have, it really wouldn't have been possible without iaptus. So as I mentioned, we have kind of the drop-in side, but we also have the referral side, and it's been really helpful on iaptus to activate those different pathways. And in terms of then collecting data and understanding actually how many drop-ins are we receiving, how many referrals are we receiving, how many referrals are under 16 versus over 16. We've been able to do that really nicely with iaptus and make sure that kind of staff know and they feel confident to move clients into the correct pathways as well. I think in terms of the other aspects of things, it's around internal monitoring and staff performance, which has been really helpful. With iaptus, we've kind of got everything in one place. So here we offer risk assessments, interventive assessments. That's sort of the key crux of our offer and what every young person comes in to receive. And we have those templates on iaptus, so it gives really easy access for practitioners when filling out information, ensuring that actually we're asking all the right questions, we're getting all the right information, and nothing's sort of being missed because we have that functionality of building in our own template into the iaptus platform. So it's been really helpful, and I think just generally monitoring staff performance as well, we've been able to utilize iaptus to pull that data and flag up any gaps or any training opportunities where we think actually this is a key trend coming up. So in terms of emotion-based school avoidance, it's definitely something iaptus helped us spot in terms of our assessments and what's coming up and the key reason for referral. And as such, we've kind of brought in training as a result, ensuring that practitioners feel confident when young people are presenting with those sorts of things.
And what kinds of people can make referrals? So obviously it's drop-in as well, which is lovely. But if you were going to be referred, tell me who can make those referrals.
Absolutely. So we work really closely with our local CAMS team, so Ealing, Hounslow, Hammersmith and Fulham as well. And we also work really closely with social care. So we've just received a referral today actually from a social worker of a young person that she's working with. So it's about having these pathways available in terms of referrals, but also ensuring that our partners know as well that we're here to support young people nearing crisis or needing de-escalation, but we're not a sort of substitute for those services like CAMS, social care. We're very much used alongside them. So we do receive a lot of referrals from our partners like CAMS, social care, sometimes the police as well, to provide support in those hours where perhaps other services aren't open and they're needing immediate de-escalation, but A&E isn't kind of the appropriate place to go.
And I read that the service is suitable for children and young people between 5 and 18. Presumably, when they're at the younger end of that scale, they come with a parent. But if they were to arrive at a very young age without, are you still able to see them and support them?
Yeah, so we have a policy where anyone can sort of come in and we will sort of either signpost or support. But in terms of the younger ones, if they're under 16 and presenting without a parent, we would need to call the parent, gain consent from them. Obviously, unless there's a safeguarding risk at play or something else that we don't know about, we kind of think about it on a case-by-case basis as well. But definitely, so long as their parent is okay with them being here, they can come and pick them up. They can have a chat with us after to discuss any of the key risks that came up, the outcome from the assessment as well. Then absolutely, we would definitely be able to support them.
And you've obviously got a really welcoming, calming area here in the cafe behind me. Tell me about the rest of the building.
Yeah, absolutely. And hopefully you'll get some kind of snippets in here as well. But it's two kind of rooms. One of the rooms are a sensory room. So that's particularly helpful for young people with neurodiversity. And if we think about A&E as an alternative, A&E for someone with a high level of sensory needs, it can be very overwhelming, it can be very overstimulating. So the whole service has been built with the kind of key thread that goes within this is co-production. And this was kind of built with our local CAMS neurodiverse teams and neurodiverse young people who come in and kind of advise on the space what they wanted that to look like. So that's the kind of sensory room. Then we have a more kind of traditional one-on-one room, which is called the green room, which again was co-produced with young people and co-designed with them. And that's kind of more for the older ones, I would say, or for young people who kind of don't really want to be in the sensory room. And then we've got the back room, which is a lot bigger, and that's where we host a number of groups. So we have psychoeducation groups, creative art groups, and music groups as well. So it's thinking about for young people who have already accessed the circle, we can refer them internally to one of these low-level groups for them to continue on practicing their coping strategies, practicing what they've learned, but also building their own toolbox of coping strategies and making sure that they're kind of well going forwards in the long term too.
That sounds great. And finally, how are you utilising the data within iaptus to evidence the effectiveness of the service and how much you're helping young people?
So in terms of the data that we collect, it's ESQs that are kind of our key outcome measures. So that's an experience service questionnaire. All of that data, iaptus has the functionality for us to upload the ESQs onto each case's iaptus. So it's thinking about when we show outcomes to commissioners, when we show outcomes to our partners, we can really understand actually, okay, what's going well, what's not going so well. And again, in terms of training opportunities, like, is there something we need to buy in to help staff with? Or is there kind of key things coming up in terms of the feedback that's being received? And as I said earlier, with the co-production element of things, this is really helpful. And we use that alongside with another questionnaire that we've built into iaptus for us to capture actually what young people want to see. Because I think the needs of young people are very evolving. we're living in a time where things are changing so quickly, especially post-COVID. And it's about thinking, you know, yes, whilst we are inclusive at this point, that's not to say we're always going to be inclusive going forward. So how can we continue to promote inclusivity, promote co-production, and have young people's voice always reflective of the space that we're working in as well? But alongside that, it's thinking about just spotting general trends and data and being able to feed back those trends and outcomes to our partner agencies as well.
And in terms of funding, was it an initial 18 months, the funding for this cafe, and is it secure going forward?
Yes, a great question. So initially it was set up as a test and learn kind of pilot, 18 months. And in terms of the outcomes that we've had, the young people we've seen, and again, that's all held within iaptus. When we presented that back to the commissioners, they were really happy with the work that we were doing and how we were collecting our information, demographics, what we were seeing. And they've actually extended the funding for another 2 years, which is really great. So we're going to be around for another 2 years delivering services. And now the kind of focus shifts to trying to find long-term sustainable funding to ensure that we are staying within the community and we are able to give that continued care in the community as well.
So as long as you're showing that it's doing good work and reiterating with what the young people need, and then you should be
good to go, hopefully.
Good to go.
Exactly.
Right. Thank you.
Thank you.